The gallbladder is a small but important organ. It's shaped like a pear and sits in the upper right part of your abdomen. It is nestled just underneath the liver. Think of its location as being tucked away safely behind your lower ribs on the right-hand side. The liver is a much larger organ and it produces a special fluid. This fluid is called bile. The gallbladder works very closely with the liver. It's a key part of your digestive system, helping your body to process the food you eat, especially fats. Its small size can be misleading, as it performs a very specific and helpful job for your body every single day. The main job of the gallbladder is to act as a storage pouch. It holds onto bile that the liver makes. Bile is a greenish-yellow digestive liquid. It is made mostly of water, bile salts, cholesterol, and bilirubin. Its main purpose is to help your body break down fats from the food you consume. When you are not eating, your liver is still producing this bile. The gallbladder collects this extra bile, holding it until it is needed. It's like a small reservoir, waiting for the signal to release its contents to aid in digestion when you finally have a meal. When you eat a meal, especially one that contains fats, your body sends a signal. This signal tells the gallbladder that it is time to get to work. The gallbladder then contracts or squeezes itself. This squeezing action pushes the stored bile out. The bile travels through small tubes called bile ducts. These ducts lead from the gallbladder directly into your small intestine. Once in the small intestine, the bile mixes with the partially digested food. It efficiently breaks down the fatty parts of your meal so your body can absorb the nutrients it needs from them. This process is a wonderful example of teamwork within the body. The liver produces the bile continuously. The gallbladder stores and concentrates it, making it more potent. Then, at precisely the right moment after you eat, it releases this concentrated bile to help with digestion. This system ensures that your body can handle different types of food, making the most of the energy and vitamins found in fats. Without this well-timed release of bile, digesting fatty foods would be much more difficult for your body, leading to potential discomfort and digestive problems. It's a simple yet elegant biological mechanism. Sometimes the substances that make up bile can become unbalanced. This can lead to the formation of gallstones. These are hard, pebble-like deposits that form inside the gallbladder. They can be as small as a grain of sand or as large as a golf ball. Gallstones are the most common problem to affect this organ. They often form when there is too much cholesterol or too much bilirubin in the bile. For many people, gallstones may not cause any symptoms at all. They might remain in the gallbladder quietly, without causing any trouble for years and years. Another common condition is cholecystitis, which is inflammation of the gallbladder. This most often happens when a gallstone blocks the cystic duct. This is the tube through which bile exits the gallbladder. When the bile cannot get out, it builds up inside the gallbladder. This buildup causes pressure, swelling, and irritation of the gallbladder wall. The inflammation can be acute, meaning it comes on suddenly, or chronic, meaning it is a long-term issue. An acute attack can be very painful and may require immediate medical attention to prevent serious complications like an infection or a rupture. Biliary colic is not a condition itself, but rather a specific type of pain. It is caused when the gallbladder contracts to push out bile, but a gallstone temporarily blocks the way. This blockage causes the gallbladder to squeeze even harder, leading to intense, cramping pain in the upper abdomen. The pain usually starts suddenly, can last for a few hours, and then subsides as the stone moves away, and the blockage is relieved. While the pain goes away, the underlying problem of having gallstones remains, and these painful episodes are likely to happen again in the future. Less common, but still important, are other conditions like cholecystolithiasis. This occurs when a gallstone moves out of the gallbladder and gets stuck in the common bile duct, the main tube that carries bile to the small intestine. This is more serious as it can block bile flow from the liver as well, leading to jaundice. Gallbladder polyps, which are small growths on the inner lining, can also occur. Biliary dyskinesia is a functional disorder where the gallbladder doesn't squeeze properly, causing pain even without stones. These varied conditions all disrupt the normal flow of bile. The most common sign of a gallbladder problem is pain. This pain is often felt in the upper right or center of your abdomen. It can be a sharp, cramping, or dull ache. The pain might start suddenly, especially after eating a meal that is high in fat. Sometimes the pain can spread. You might feel it in your right shoulder or between your shoulder blades in your back. This type of pain, known as biliary colic, can be very intense and can last for several hours before it starts to fade away. It's a clear signal that your gallbladder is struggling to do its job properly. Digestive issues are another major clue. You might feel sick to your stomach, a feeling known as nausea. This can sometimes lead to vomiting. Many people with gallbladder problems also report feeling very bloated or having a lot of gas. They may experience indigestion or heartburn, particularly after eating. Chronic diarrhea can also be a symptom. This happens when fats are not being digested properly due to a lack of bile. These digestive disturbances can be very uncomfortable and can significantly affect your quality of life, making mealtimes a source of anxiety instead of enjoyment. A change in the color of your urine or stools can be a serious warning sign. If a bile duct becomes blocked, a substance called bilirubin can build up in your bloodstream. This can cause your urine to become very dark, like the color of tea or cola. Your stools, on the other hand, might become very pale or clay-colored. This happens because bilirubin is what normally gives stool its brown color. Its absence from the digestive tract is a clear indication that the flow of bile from your liver and gallbladder has been obstructed somewhere along the line. Finally, a blocked bile duct can lead to jaundice. This is a condition where your skin and the whites of your eyes turn a yellowish color. This yellowing is caused by the high levels of bilirubin in your blood. Jaundice is a serious symptom that always requires medical evaluation. Along with jaundice, you might also experience a fever and chills. This can be a sign that the gallbladder or bile ducts have become infected, a complication that needs prompt treatment. Paying attention to these combined signs is crucial for getting the right diagnosis and care. If your gallbladder is causing significant problems, your doctor may recommend that it be removed. The surgery to remove the gallbladder is called a cholecystectomy. Today, this is most often done using a minimally invasive technique. This is called a laparoscopic cholecystectomy. The surgeon makes a few very small incisions in your abdomen. A tiny camera and special surgical tools are inserted through these small cuts. The surgeon then uses the camera to see inside your body and carefully removes the gallbladder. This method usually results in less pain, a shorter hospital stay, and a much quicker recovery time. In some situations, an open surgery may be necessary. An open cholecystectomy involves one larger incision in the abdomen. A surgeon might choose this approach if the gallbladder is severely inflamed or scarred. It may also be used if there are other complications that make the laparoscopic approach unsafe or difficult to perform. Recovery from open surgery takes longer than recovery from a laparoscopic procedure. You will likely need to stay in the hospital for a few days and will have more restrictions on your activity for several weeks as the larger incision heals properly. After the gallbladder is removed, your body can still digest food. You can live a perfectly normal and healthy life without it. Your liver will continue to produce bile, just as it always did. However, instead of being stored in the gallbladder, the bile will now drip continuously, in smaller amounts, directly into your small intestine. This means your body will still have the bile it needs to break down the food you eat. The storage function is gone, but the essential production and delivery of bile from the liver will continue uninterrupted for the rest of your life. Most people recover very well from gallbladder removal and do not need to follow a special diet long-term. In the first few weeks after surgery, you might be advised to eat a lower-fat diet. This gives your body time to adjust to the new way that bile is delivered. Some people may notice that their stools are a bit looser, especially after eating a fatty meal. This usually improves over time. Your digestive system is remarkably adaptable. It learns to work efficiently without the gallbladder, allowing you to return to your normal activities and enjoy your life without the pain and discomfort you had before.